Hello everyone. Some students often feel unsure when answering questions that require a suggestion. To help you build confidence, here are some sample questions along with answers to show you that these questions aren't as difficult as they may seem. Let's get started. Question 1. Suggest how pain in patients can be measured objectively, other than using a self-report scale. This question is worth 2 marks. Pain in patients can be measured objectively using behavioral observation tools, such as the UAB Pain Behavior Scale, which records observable pain-related behaviors, such as grimacing or limping, over a period of time. Question 2. Suggest how the effectiveness of cognitive behavioral therapy, CBT, in treating OCD could be measured using an online questionnaire. This question is worth 2 marks. The effectiveness of CBT in treating OCD could be measured using an online questionnaire that asks participants to rate their symptoms before and after treatment using scales, such as the Yale-Brown Obsessive Compulsive Scale, YBOCS, along with questions on their overall satisfaction and perceived improvements in daily functioning. Question 3. Suggest one way in which pyromania could be measured, other than by self-report. This question is worth 2 marks. Pyromania could be measured through behavioral observation in controlled settings, tracking instances of fire-starting behavior, and recording the frequency and context of these behaviors as a way to assess the severity of the condition. Q4. Suggest one problem that could occur if random allocation had not been used in the study by Savage and Armstrong 1990. This question is worth 2 marks. If participants had not been randomly allocated to the conditions of the study by Savage and Armstrong, there could have been selection bias, where certain types of patients, such as those with a preference for one consultation style, could have been more likely to be in one group, affecting the results and making it difficult to attribute differences in satisfaction to the consultation style itself. Question 5. Suggest one alternative treatment that could be used for managing and controlling shoulder pain. This question is worth 2 marks. An alternative treatment for managing shoulder pain could be acupuncture, which involves inserting fine needles at specific points in the body to release endorphins and reduce pain. This treatment has shown effectiveness in managing musculoskeletal pain, including shoulder pain. Question 6. Suggest how the diagnosis of Munchausen syndrome could be made without using rating scales. Your suggestion must be ethical. This question is worth 2 marks. The diagnosis of Munchausen syndrome could be made through clinical interviews with the patient, observing patterns of frequent hospital visits and inconsistent health records, and gathering detailed medical histories from multiple practitioners. Ethical considerations should include maintaining confidentiality and ensuring the patient's well-being throughout the assessment. Question 7. Suggest one way that pain in children could be measured, other than by the YBOCS and MOSI. This question is worth 2 marks. Pain in children could be measured using the FACES Pain Rating Scale Revised FPSR, a tool specifically designed for young children, which allows them to indicate their pain intensity using faces ranging from no pain to the worst possible pain. I hope this clarifies how to approach suggestion-based questions. Remember, with practice, they'll become easier. Thank you.